here now is the CEO of Florida Health Choices to give us an outline of what she can do, what the agency can do, and what they can do. So she's going to take 10 minutes, I guess, to give us a little brief overview, and then we're going to go into this bill. So if you have questions, she'll still be here for questions and things. But Rose Naff, welcome. We're glad to have you here. You are recognized.
Thank you, Chairman. It's Rose Naff, CEO of Florida Health Choices, and I read recently in the newspaper that we've done nothing. So I thought it best to show you what we have done. Being a student, I like to think a good student of the Bean School of Brevity. I have a very short video. We've done all the data entry for you and zipped through it. It's going to go kind of fast, but you're going to meet three people. You're going to meet Tommy. He's a Florida licensed insurance agent working at Hahn Insurance. He's going to register on the marketplace, confirm his license, and start to help one of his clients. His client, Sally, is a business owner in the medical supply business, and she wants to shop and compare small group coverage. And Lionel is an employee of the business that Sally owns, and he'll sign up for coverage during the open enrollment period.
So you brought a clip with us, so let's show the clip. How about that? Roll the clip.
First, you're going to see Tommy. He's going to go to the site, fill in, create a profile.
So Tommy's just logged in, creating a profile. That's how easy it is. You can just go on and log in.
Filling in some general contact information, then he inserts his license, and we get a result from the Department of Financial Services confirming his license is in active status, and he's a registered Pathfinder with us. So now he's going to go back to the site, and he's going to get a quote for his client. He goes to get a quote.
818.
He enters some basic information about his client, chooses the June 1st coverage date, and enters the census of employees that work at the business. It presents the Shop and Compare platform. He can adjust the employer contributions. It starts at 50. He's going to raise it to 75%. He can make that 75% apply to any plan or to the lowest cost plan available. He can go to percentages or fixed dollar amounts, recalculate the premiums, and they changed for him. He can also sort on a variety of criteria. He can sort by the company name, by the plan type. There are several options there.
So it's almost like Travelocity or a travel site. You can choose or custom design whatever you're looking for, and it'll filter for you.
He can look at disclaimers. He can click on provider link and go to a deemed link within the company's search engine. Later on, we'll have our own search engine that will be added to the site. He can go deeper into the benefits and look at them on a plan-by-plan basis. Lots of detail. Or he can do a side-by-side comparison of up to 4 plans. Here he's chosen 2 Florida Healthcare and 2 Florida Blue. He's going to look at them side by side. He can view his dental options, and there are similar functionality built into the dental shop and compare as well. He can look up a single dental plan, or he can look at them side by side. He can sort them. He can add and subtract employer contributions.
So you've built this. How many people could sign on at once, or how many people, is there a number that you have?
At the moment, it's designed for small groups of 1 to 50.
Groups of 1 to 50, but how many groups of 1 to 50 could come on and sign up? Is there a number, or is it?
There's no limit.
There's no limit. So it's a super highway of information that anybody could jump on, and there's no limitation.
Correct. Now he's going to select a vendor, and he's now sending the initial quote to his client, Sally Smith. She's received an email letting her know the quote's available for her. She's logging in, and it says she has 1 new quote available. She clicks it. She looks at her initial quotes. She likes what she sees, and she decides to request an underwritten rate. She reviews her census to make sure it's correct, and it goes off to the companies. When the final rates are available, she'll be notified by email again. It says her rates are available. She's looking at her final rates. She decides that she is going to buy on the marketplace, so she starts her application. Completes some general information regarding the employer, and now she's going to pick up to 4 plans that will be available to her employees. She's going to pick the first 4. The system's going to ask her a couple of questions, ask her to revalidate her employer contributions. She has a chance to review all pieces of the application before she finalizes it, and she presses continue. Reads her terms and conditions, and she can e-sign the terms and conditions. Sally's Medical Supplies is in, and next she's congratulated, and her employees are going to be invited to the open enrollment. Her employee Lionel is going to register. It says it's time to enroll now. He's immediately presented with his 4 options. He can pick the type of coverage he wants. He can choose coverage for himself and dependents, whole family, himself and spouse, the gray box on the upper left. It will change the price each time he clicks based on the options that he's choosing. He can view disclaimers. He can compare plans side by side. He can go to the provider directories.
So they're rocking online. What if somebody doesn't have computer access? Can they call a number, or could they do something else?
At the moment, we're supporting electronic only. We will support paper applications in the future. However, that electronic support is available by calling the call center. We can actually process
So
the
there's a number.
application.
I can call an 800 number, and they can walk me through it.
Yes, toll-free number.
Okay,
Call
very
center
good.
based here in Tallahassee. He has 2 options here. He can either pick his plan or he can waive coverage. In this instance, he did not pick a plan. He tried to continue. It said, do you want to waive coverage? He said, no, I don't. He went back, and now he's picked his plan, and he continues with the enrollment. He'll be asked basic contact information. Sally will be notified when Lionel and all of his coworkers have completed their election of coverage. And in case you missed it, Lionel picked Florida Healthcare Plans, balance $500, point of service S37. His share of premium is $142 per month, and he chose single coverage to begin June 1st.
Very good. Members or senators, if you want this presentation emailed to you to see how easy it is, you just saw somebody not only pick a health plan, but an agent enroll, and the employees were picked up. That was compressed, but how easy it is, almost like a travel site where you can go in and customize exactly what you're looking for. It's exciting, it's cutting edge, and it's offered to folks that utilize Florida Health Choices. Are there questions of Rose Naff, the CEO? Senator Joyner for a question.
Thank you, Mr. Chair. I'd just like to know, now, isn't the corporation in existence right now, correct?
The corporation is in existence. We are currently loading Florida Blue, Florida Healthcare Plan, Liberty Dental, Argus Dental are being loaded onto the system as we speak.
So how many people are enrolled and how many are employed by the corporation?
Corporation has 2 employees, and there are 0 enrollees at the moment. We're on the brink of launching the marketplace.
Well, what is the maximum, if any, that you anticipate that the corporation will enroll, with the max that the corporation can handle?
The system is scalable. I wouldn't say there's a maximum of people that we can enroll. Our target is to enroll between 60 and 70,000 in years 1 and 2. In the small group market, we can move into other individual products and large group in the future.
60 to 70,000.
In the small group market.
Okay, all right. I'll save whatever else I have after the bill. Thank you.
Very good. Other questions, thoughts, comments for CEO Rose Naff? Rose, thank you very much. If you will just be available for questions.
Absolutely.
We're about to present the Plan C bill, and your agency is an integral part of that. So if there's questions, if you'll stick around.
I'll be nearby.
Very good. Thank you so much for coming forward.